Good morning, everyone. We'll start today's briefing with Dr. Alex Jahangir, Chair of Metro's COVID-19 Task Force and Chair of the Metropolitan Board of Health. We'll also hear from Dr. Gil Wright, Interim Chief Medical Officer for the Metro Public Health Department. Also here will be Director Chief William Swan of the Office of Emergency Management and the Nashville Fire Department. Dr. James Hildreth had planned to be here. He had a last-minute schedule change, so he will not be here this morning. We'll begin now with Dr. Jahangir.
Good morning, Nashville. Mayor Cooper continues to quarantine at home after his wife was diagnosed with COVID-19. I did speak with him this morning, and he's doing great and is following CDC guidelines. The mayor tested negative for COVID-19 yesterday, and Mrs. Cooper is asymptomatic and doing well. He asked me to thank you for the well wishes that has been sent his way. Now here's the latest on coronavirus in Davidson County. Nashville hits another sobering COVID-19 milestone this morning as we pass the 500th death from coronavirus in Nashville. In fact, 502 Nashvillians have now died because of this virus. On the wall of the historic courthouse, the Victor Memorial Bridge Monument honors the lives of 754 Nashvillians that were lost at World War II, the Korean War, and the Vietnam War. Tomorrow, Metro will create another kind of tribute to remember those we've lost to COVID-19 by planting 500 flags on the front lawn of the courthouse. Each life we've lost in this pandemic is a tragedy, and we mourn those who have lost loved ones. Today, there are 6,767 active cases in Davidson County. This is slightly down from the 6,800 that were active last week at this time. And we now have had 73,533 Nashvillians who have been infected by this virus. That's an increase of 1,203 just from yesterday. A rolling 14-day average of new cases is 594, which is stable compared to where it was last week at 593. And our 7-day average of new cases per 100,000 is 85.2. And Nashville and Davidson County is 30th out of 95 counties for disease activity in Tennessee. Our 7-day positivity rate is 21.5. That means 1 out of every 5 Nashvillians who are currently being tested are testing positive. This is the highest this number has been since the beginning of this pandemic. And we are testing a lot in Nashville. I mean, thus far, we have tested nearly 830,000 individuals. And our transmission rate remains at 0.89, slightly less than the 1 it was last week. Hospitalizations are also at a record high in our area right now. In Middle Tennessee hospitals today, 1,018 patients are hospitalized with COVID-19, and in Nashville hospitals, that number is 597, up from 550 just last week. Now, Davidson County has been in the 1A1 vaccination phase for several weeks now. These include frontline healthcare workers who are getting vaccinated by their hospital systems, residents and staff of long-term care facilities who are being vaccinated through pharmacies in a joint federal and state program. And the Metro Public Health Department is helping vaccinate first responders. So far, we have vaccinated nearly 3% of our county's residents, and we are now in a place where we can advance in our phases of vaccination. Today, we are announcing that we are moving to phase 1A2, as well as vaccinating our residents over the age of 75. This weekend, Metro Public Health will begin vaccinating Davidson County residents over 75. This will be by appointment only, so we can maintain social distancing and not have people lined up outside and ensure that those who are there will get vaccines. Dr. Wright will give more information on this weekend and how to make an appointment later today. This is a great start, but in addition to what we are doing at Metro Public Health, there will be many other ways for those over 75 in our community to get vaccinated. HCA TriStar, Vanderbilt University Medical Center, Ascension St. Thomas, Meharry Medical College, Nashville General Hospital, as well as the Veterans Administration Hospital, are all making plans to vaccinate their established patients in the very near future. If you are a patient who gets your health care from one of these great medical centers, be on the lookout for more information from them on how you can get an appointment for your vaccination in the near future. I want to reassure all Nashvillians, we are working hard and planning to get everyone vaccinated as quickly as possible. But this will take time, and this will be a joint effort by many entities in our city. It's similar to March when we were working hard to get our residents tested. We had plans in place, and like now, these plans involved a coordinated effort with all of our health systems. And once we started receiving tests at that point, we started ramping up our testing process. A process which I have to say now has tested over 300,000 people in our community assessment centers and nearly 830,000 people in Nashville. The same is true for vaccines. As the supply of vaccines increase, we will quickly turn around and put vaccines in arms. Remember, the vaccine is the end game for the pandemic. But until we get thousands of people vaccinated, we are not there yet. So we have to be vigilant, not let our guard down, continue to do your part. Stay apart, wear a mask, keep your distance, and wash your hands. And if you're concerned about being exposed, get a test. Also, if you are infected with COVID-19 and you know this early because you were tested, there are now treatment options, such as immunoglobulin therapy, that if received early in the course of the disease by those who meet criteria, can prevent the worsening of the disease and prevent hospitalizations and death. This is why it's so important to get tested early if you think you're sick. Finally, it's time for our Heroes of the Week. As we begin our new year, today we salute our frontline healthcare workers. They have been there since the beginning of this pandemic, putting their health at risk to take care of others. All of those people who are ensuring our healthcare systems continue to operate, our doctors, our nurses, our therapists, our pharmacists, our support staff, and all of those working in the hospitals. On behalf of everyone in Nashville, thank you. I now would like to introduce Dr. Gil Wright.
Thank you, Alex. Good morning, everyone. As we begin the new year, Metro's COVID-19 vaccine program is moving forward. Davidson County has the largest Phase 1A1 group in the state at nearly 50,000 or 55,000 qualified recipients. Since December 17th, we have given nearly 30,000 vaccinations in Davidson County during our first phase. This includes over 26,000 hospital workers, 1,688 first responders, 1,359 other frontline workers. Starting today, Metro Public Health is ready to begin Phase 1A2 and Davidson County residents age 75 and older. This is in addition to its seniors who are already receiving vaccination through long-term care facilities. Metro is committed to creating and carrying out a thoughtful and equitable vaccination strategy, one that provides all of our seniors and community the opportunity to get vaccinated. We'll do everything we can to avoid the long lines and confusions that we've seen in other places. This Saturday and Sunday, Metro Public Health Department will open 600 appointments for each day on Saturday and Sunday, or a total of 1,200 appointments for the weekend to vaccinate Davidson County residents who are 75 and older. We will be scheduling those appointments for Saturdays and Sundays throughout the end of January, with plans to add additional time slots as the supply of vaccine allows. We will also have a wait list should all of the appointments fill up. To make an appointment, you can visit COVID-19 at nashville.gov at any time, or if you don't have access to the website, then call 615-862-7777 between 7 a.m. and 7 p.m., and they will make an appointment for you. This number is available 7 days a week. You'll be asked to provide some basic contact information to make your appointment. Once your appointment is confirmed, you'll receive a time slot and address so that you will know where to go to get your vaccination. We will continue to expand opportunities as we receive more vaccine. We'll work through the wait list until every Nashvillian 75 and older has an opportunity to get the vaccine. And again, to make an appointment for a Saturday or Sunday to be added to the wait list, you can visit COVID-19 at nashville.gov, or you can call 615-862-7777 between 7 a.m. and 7 p.m. In addition, Metro Health, there are other ways people 75 and older will be able to get the vaccine in the near future. As Alex mentioned, HCA TriStar, Vanderbilt Medical Center, Meharry, Nashville General, Ascension St. Thomas, and the VA Health System are currently making plans or have already made plans to start to vaccinate their established patients. So if you're 75 and older and have been receiving care from one of these systems, keep an eye out for information from them directly about how you can get a vaccination. As part of Phase 1A2, Metro Public Health will also begin offering the COVID-19 vaccine to other Phase 1A2 recipients starting today. Those eligible in this phase include outpatient healthcare workers with direct patient contact, like dentist's office, chiropractors, and home health organizations. Funeral and mortuary workers are also part of 1A2. The health department will reach out to these businesses and organizations by email starting today. The Phase 1A2 process may start slowly, but we are working with all of our health systems to get the vaccine into as many arms as soon as possible and as quickly as possible. Remember, we can't relax our guard just because the vaccine has arrived. The very first hospital workers to receive the vaccine in Nashville will receive their second dose starting today. And it takes 2 full weeks from the second dose before they will achieve full immunity. Masks, social distancing, and avoiding large gatherings are our best defense against the virus while the vaccine has time to do its job. And now, I'd like to turn it over to Director Chief Swan.
Thank you, Dr. Wright. So good morning, Nashville. I'm going to do a quick update of where we're at as far as the historic downtown recovery. Since the Christmas Day tragedy, Metro government departments have come together to accomplish the shared mission of recovering and restoring our beloved historic downtown. Work was underway in places we could safely access to inspect buildings and utility infrastructures even before the FBI returned all operations to Metro government. Inspectors from Metro Codes, Public Works, structural engineers, and utility companies have been able to ensure the safety of a number of buildings in areas affected by the explosion. We know at least 37 buildings are impacted, with 18 suffering minor or major damages. This tragedy has displaced at least 400 residents, 1,200 employees, and impacted more than 45 businesses. We have worked hard to communicate with our downtown businesses by keeping them up to date with daily progress reports. I want to thank Councilmember Freddie O'Connor and Tom Turner from our downtown partnership in helping us disseminate this information. An entry control point has been established at the location of First Avenue and Broadway. Nashville Fire and Police assigned urban search and rescue teams to escort residents, business owners, and others into damaged areas to help assess the damage to their properties. Also, our USAR members are on site to help individuals collect items from their homes and businesses. Because of this work, our personnel have helped reunite pets with their owners, retrieve critical documents, and also save priceless mementos. I cannot say enough about the work of the Office of Emergency Management, our USAR personnel, Nashville Fire Department, Police Department, Metro Water, NES, Piedmont Gas, Codes Department, our communication partners, AT&T, and a special thanks to Public Works for their work, not in just the minutes following the tragedy, but in the several days since the attack on our city. Because of this work, we have businesses who will be able to reopen once they contact the Office of Emergency Management for further instructions. This will allow for the businesses that are able to open for customers. We will continue to reduce their area we labeled as restricted as work crews are able to secure more buildings and safely restore utilities. Part of the recovery is allowing our neighbors to return to their properties. This weekend will be Nashville Strong Moving Day for the affected 2nd Avenue residents and business owners. The moving day will be Saturday and Sunday from 7 a.m. to 4 p.m. each day. We sent emails to individuals asking them to reserve 3-hour blocks of times on either day to retrieve their belongings. We will have our urban search and rescue teams available to escort people into damaged areas. Officers will also work to accommodate moving vehicles. Other Nashville Strong Moving Days will be held later for those who cannot take part this weekend. 2nd Avenue business owners and residents who did not receive an email can request additional information by contacting MNPD Sergeant Brian DeLapp. For people wanting assistance, you can call 311 and 211 to be connected to available resources. You also can go to hubnashville.gov. There you will find a section for the Historic Downtown Response Recovery. Once again, it is hubnashville.gov. So Nashville, we are on the road to recovery, and every day we are making progress. And I want to thank everyone who is working tirelessly to restore our historic 2nd Avenue. Thank you.
Thank you, Chief. We'll now start taking questions first. Blake Farmer, WPLN. Good morning, Blake.
Good morning. Thanks for taking the question. When you all open up vaccinations for 75 plus, how do you all plan to make this sort of an equitable approach? And I ask this having been at vaccination sites elsewhere in the state this week. How do you make sure that it is a good cross section of folks who are coming, not just folks who find their way to the front of the line?
We'll have Dr. Wright answer that.
Blake, that's a great question. It's something that we've been thinking about for a long time and discussing. We will be working. First thing we realized is a lot of these people may not have access to websites, so we did open up a phone line so that we could get them registered. We have sent this announcement and information out to a number of our partners in the minority communities so that they can share it and assist their individuals. We are working with Meharry as well as the other health systems to provide additional opportunities as soon as possible to reach these different parts of our community.
Thank you. Blake, just to add on to something that Dr. Wright had said, we've learned a lot in the past 10 months, and the at-risk Nashvilleian plan that we've followed, I think will help us. We've already got the established relationships, and we're going to work with those established relationships. I think in some of the other areas, like you saw in Daytona Beach, Florida, I don't know that they had appointments. And so people, it was first come, first served, and you had a 4-mile-long line of traffic. And of course, we're going to do all we can, and we need your help as well to make it very clear that this is by appointment only. We're going to have 4,800 appointments in the next 4 weekends and a wait list. So we're going to try to move this through quickly, safely, and equitably. Our next question is from Harriet Wallace from Channel 17. Good morning, Harriet.
Good morning, Brian. Good morning, everybody. Excuse me. I just want to get you all's thoughts because there's some teachers across the state as well who have been notified by the state health department that they will not be getting their vaccinations at this time. They're suspending them because of the vaccination shortage. My first question is, how are we looking in the metro area? Any concerns with vaccination shortage or that impacting who gets the vaccination and when? Secondly, just, and if Dr. Hildreth, I believe, may be there, or Dr. Jahangir, if you could speak to just in general, the importance of school faculty receiving the vaccination as we look at reopening schools safely. Thank you.
Thank you, Harriet. We'll get
Thank you, Harriet. As you know, the state of Tennessee has designated teachers and school faculty in the group 1B. So as we mentioned, we are rolling into group 1A2 today, as well as those over 75. There's two tracks. There's an age track and then a phase track. Our hope is as we start getting through our 1A2 group, as well as our 75 and older track, Nashville will begin going into group 1B, which is our teachers. The rate limiting step there is, as you said, is vaccine, which is a supply that is provided to the state by the federal government and allocated to us. We have been talking with schools. There's been a lot of discussion around how best to get teachers and our staff at our schools vaccinated when that becomes available. To your point of getting people vaccinated, I think schools and getting teachers, staff, and so forth, just like any essential worker, frontline worker vaccinated is critical. What makes schools unique is while transmission seems to be less from kids to adults, there's a lot of interaction with people, and I think getting people vaccinated as quickly as possible is important. There are a lot of factors, obviously, to opening schools and so forth, but that I think would be an important one. And our hope is as soon as we can to get teachers vaccinated again in a way that is consistent, that doesn't run out of supplies, and that happens in a fast way. So we'll see how that goes. Thank you.
Our next question comes from Brett Kelman from the Tennessean. Good morning, Brett.
Good morning, everyone. I have a couple of nuts and bolts questions about the vaccine rollout that I'll try to cover as quickly as possible. First, I'm curious where these vaccinations are physically going to happen, and if the city intends to keep this phone number and website registration system as it moves forward beyond the 75-plus category. Are teachers and critical infrastructure workers also expected to do this when their time comes? And secondly, Brian just mentioned that at this schedule of 600 vaccinations per weekend day over the month, we're looking at 4,800 vaccines by the end of the month. In a city the size of Nashville, that's not very much. Is there a plan to expand this beyond just weekends in the not-so-distant future? Or is the limiting, what's the limiting factor there? Is it work hours or vaccine supplies or manpower? How is the city going to get beyond 4,800 vaccinations in a month?
Let's see. We'll have Dr. Wright answer those questions first.
Thank you, Brett. So we do intend to keep the phone lines, the address, and all of those things throughout this process for each of our groups. As we move through each group, we're going to move as quickly as we can. We're going to make sure we're not going to wait till group 1A1, which we're just finishing, is quite done but we've seen a drop off in the numbers. So we have time slots. We need to be offering those so that we can move as quickly as we can through. As you mentioned, this is a large community. It's going to take us a long time to get through the entire population. So as quickly as we can. That's why it's very important for us to depend our partnerships that we've got with all of our health systems here in Davidson County to help leverage the ability to get more vaccines into arms. The other thing is our rate limiting step right now is vaccine. There have been some, I think, some hiccups along the way, but we're seeing a more steady stream that appears to be coming. You know, if you roll out this kind of a very, very large logistical problem, we can expect a few problems along the way, but I think it's being improved, and expect to get increasing doses of vaccine. So as we get increasing doses of vaccine, we're looking at where all we're going to be giving the vaccine. We're trying to find large facilities where we can have 1,000, 2,000 vaccinations a day in those sites. And so we're moving through that. But it will be the same process pretty much as we move from one group to the next. You have some additional?
Brett, the one thing I would add to that is, again, there are going to be many entities in this city that are going to help get people vaccinated. I think you look at 1A1, we had our first responders partner with us and TriStar HCA to get them all vaccinated, right? When it comes to teachers, it may be a coordinated effort between us and several of the health systems to get everyone vaccinated in a quick fashion. So I think, again, what I would ask of my colleagues in the media is recognize that there will be, this is a all hands on deck effort. We will communicate that very clearly. We will do everything we can within the Department of Public Health's abilities, but there's going to be a lot of different partnerships that as we move through the phases we'll incorporate. And then again, I believe operationally we can get a lot of vaccines in once the supply is there. So that I feel comfortable. Just like we did when it came to testing, we took our time operationalizing how our testing centers would run, and for the most part, we've had pretty successful testing sites, and I believe our vaccination plan will be the same way moving forward. Thank you.
All right, our last question today comes from Peter White. Good morning, Peter.
Hi, can you hear me? I'm not muted, right? You can hear me? I can't hear you. Okay, well, if you can hear me, let me ask the question. Can you nod if you can hear me? Okay. My question has to do with what the authorities there think about the sort of hodgepodge nature of how this vaccine rollout is happening. Just like the testing, which was sort of left to the states and then left to the counties. Some did better than others. And overall in the state of Tennessee, the COVID testing has not been successful. So I want to know what people have to say about what their thoughts are on a more coordinated response federally. In other words, it only takes a couple of seconds to get a shot. The thing that's going to create problems is all the paperwork, like who are you and all that sort of stuff. And I don't think a local response, if it is the same as it was with the test, is going to work very well. So, any opinions on that?
Thank you, Peter. We'll start with Dr. Jahangir.
Peter, good to hear from you this morning. I think from the beginning, I agree with a part of what you said, is that a federal response, a coordinated federal response from the beginning of this crisis would have been the best way to handle this, right? Whether it's testing and now the vaccine rollout. But here's the thing. What we have been able to do on a city level, again, with the powers we have, is once we got our testing swabs, we've had a very successful testing strategy for Nashville. Our vaccine plan as well, if and when we get our vaccine supply allocated by the state, allocated to them by the federal government, I feel we have a pretty good operational plan that involves multiple entities around our great city. And so I think, maybe in 2 weeks when a new federal administration, maybe it'll be a better federal response. Great. But I think as a city, we have done a good job, and we continue to do a good job at operationalizing within the boundaries that we have power to do. And again, very successful testing that's tested over 300,000 people at no cost to them. and now a vaccine plan that has resulted in 3% of our Davidson County's population being vaccinated, and hopefully the beginning of rolling out our 75 and older and Group 1A2 and hopefully 1B in the near future. But yeah, I mean, give us more vaccines, and maybe a better federal plan, and we can even vaccinate more. But thank you for your question.
All right, those are all the questions we have for today. I'd like to say after 10 months how grateful we are for the folks at Metro Nashville Network and all the work that they do behind the scenes to make this every week possible. They do a fantastic job. And also, as always, we're thankful to Eric Workman and our partners at the Bridges for the Deaf and Hard of Hearing for providing the ASL services, translation services at these briefings. The next COVID press briefing will air on Thursday, January 14th at 9:30 a.m. Thanks for joining us, and this concludes today's briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.org.